The first time I was ever told that I had high cholesterol was when I was 26 years old. My diet consisted of hamburgers, French fries, Coca-Cola, and a few cookies. I was in medical school and I ate almost exclusively in the hospital cafeteria. And yes, of course, they had salads, and I ate them occasionally with Thousand Island dressing and added ham and eggs. High cholesterol runs in my family. I'm talking really high. So when my lab value returned at 256, I wasn't surprised. And if you've ever been told that your cholesterol is elevated, stay tuned to learn about the new guidelines about cholesterol.
I'm Dr. Vickie, and this is Healthy Looks Great on You, a lifestyle medicine podcast to help you reclaim your energy, your focus, and your well-being. Life tested, doctor approved.
No doctor has ever told me I should be on a statin, but I have been told I should be on a low cholesterol diet and exercise. And really, we should all exercise, regardless of your numbers. I'm not so sure about the low cholesterol diet, but I'll get to that. But what can you do once you've crossed the line? Let's go to mini medical school to learn about cholesterol. How low should your numbers be? What does cholesterol do? Where does it come from? And how does it affect your body? First, your body needs cholesterol. It helps build cells and make hormones, and your brain is the most cholesterol-rich organ in your body. It helps coat the nerves and keeps them conducting signals properly. But, and this is important, there is a barrier between the brain and the bloodstream. It's literally called the blood-brain barrier. And I would tell you a funny story about the joke I made about the blood-brain barrier when I first met my husband. But you probably wouldn't get it or think it was as clever as I did. He's an anesthesiologist and I'm a retired gynecologist, so if you know, you know. Anyway, some things can cross this barrier and some things cannot. And cholesterol is one of those things that cannot. Now, what this means is that your blood cholesterol level has nothing, zip, nada, zero to do with your brain cholesterol. That's why your brain has to make every bit of its own cholesterol. Nothing you eat or don't eat even crosses that barrier. However, the blood vessels that supply the brain can be affected by cholesterol levels. Just remember, everyone stays in their own lane. So now you know the brain makes its own cholesterol, but it can't be used in the body for building cells and making hormones. Never fear, the liver is here. Your liver also makes cholesterol, but this kind does circulate through the bloodstream. How much cholesterol your liver makes is determined by genetics. Remember I told you, high cholesterol runs in my family, so yep, Dr. Vickie's liver is cranking out cholesterol big time. But that certainly isn't the only determinant, because get this, in my 40s, I lowered my cholesterol by 100 points with eating a whole food healthy diet and vigorous exercise. And back in the day, doctors said that couldn't even be done. The general sentiment was that diet and exercise could shave off about 10%. But now we know that 20 to 30% is possible, and I'm living proof anyway. You probably know that there are different types of cholesterol. Some are labeled good and others are bad, and I already did an episode on the difference between the two. So if you missed the prerequisite for this mini medical school class, I put a link in the show notes. Today, we're going to talk about what is new. You see, a group of experts got together and published new guidelines for 2026. And when I say experts, I'm talking 11 different associations and groups with the heaviest of hitters, the American College of Cardiology and the American Heart Association. There's a link for that in the show notes as well if you want to read the publication. But what you really want to check out is the Prevent Heart Disease Calculator. It's also in the show notes, and that's something I say a lot. It's in the show notes, and you're over there scratching your head going, where are these show notes? Well, one way to find them is to go to my website, healthylooksgreatonyou.com, look at the latest episode, and all those links are at the bottom. But if you really want to hit the easy button, get on my email list. I'll send you every podcast episode, and links are included. But this calculator is designed to help people understand their risk for cardiovascular disease over the next 10 to 30 years. And get this, it's based on data from literally millions of people. It should only be used by people between the ages of 30 and 79 who do not have a history of cardiovascular disease. Because if you already have heart disease, you'll want more aggressive treatment. The goal is prevention, to identify people at risk earlier so that intervention can prevent cardiovascular disease later. The targets to prevent heart attack and stroke are to have an LDL of less than 100. And if you're high risk, less than 70. And if you're really high risk, less than 55. I'm due to have my physical next month, but based on last year's numbers, my risk of heart disease in the next 10 years is 4%. What's yours? To answer that question, you'll need to know your BMI, your systolic blood pressure, your eGFR, which is an indicator of how well your kidneys work. It's a blood test. Your total cholesterol and your HDL cholesterol. Up to 80% of cardiovascular disease is preventable, so pay attention to these numbers. And depending on your age and medical history, medication may be recommended if your 10-year risk is greater than 5%. Did I say statin? No. As a matter of fact, I did not. I will. But there are other options for people who cannot tolerate statins. And diet and exercise are always the first line recommendation, just like my doctor told me in my 20s. Also, the new guidelines do recommend testing earlier in life so that risk factors can be modified, especially if high cholesterol runs in your family. But not everyone can lower their cholesterol with diet and exercise, and sometimes it just doesn't get the levels low enough. So let's talk about it. Diet, exercise, and statins. And yes, this time I said statins. Exercise raises your good cholesterol, and it decreases your bad cholesterol. Exercise even makes those bad cholesterol particles bigger so they don't get stuck to the walls of your arteries and clog things up. You need a minimum of 150 minutes of moderate intensity cardio exercise every week. High intensity is more effective, but what really matters is consistency. And that's one of the things we do in the Healthy Looks Great on You lab. In March, we focused on muscles and metabolism. And we talked about resistance training too, because that has a huge impact. In April, we're going to recap some of that because the focus is heart health, including controlling blood pressure and cholesterol. Oh, I didn't tell you this class has a lab? Well, it's elective, but I highly recommend it. The Healthy Looks Great on You lab is where you move from knowing what you should do to actually doing it. It's a private, paid Facebook group for women only, and you can find the details at healthylooksgreatonyou.com/the-lab/. If you already know that you need to exercise to reduce your risk for heart disease, but you just have trouble sticking to it, then this is for you. Same for diet. While your liver is cranking out some cholesterol, what is in your bloodstream is also affected by what you eat. But it's not just about high cholesterol foods. Heart-healthy diet will be a huge focus in the April lab. But to give you the cliff notes, saturated fat increases bad cholesterol, fiber decreases it. That's the bottom line. Saturated fat affects cholesterol far more than eating high cholesterol foods like eggs. Saturated fat is found in animal products like meat, butter, cheese, and also coconut oil. But not all fat is bad. In fact, unsaturated fats can actually increase good cholesterol, like that that's found in avocados, nuts, fish, and good old olive oil. Now, fiber is only found in plants. If you've listened to this podcast very long at all, you've probably heard me say that more than a few times. Fruits, vegetables, and whole grains, and fiber traps that bad cholesterol while it's still in the gut before it can be absorbed into the bloodstream, especially soluble fiber. It helps lower bad cholesterol, and you can find soluble fiber in fruits and veggies, oats, beans, and lentils. And the standard American diet is woefully lacking in fiber. Overall, people who eat a Mediterranean diet have a lower incidence of heart disease. But if you're looking for a dietary pattern that's specifically designed to lower the bad cholesterol, LDL, then the portfolio diet has been shown to be beneficial. It is plant-based, and all the cardiologists I know personally would agree plants are healthy for your heart. But what if you insist on eating keto or carnivore? Well, first I'd say get your cholesterol checked and plug all your numbers into the calculator so you know your risk for heart disease. I'd also say do a little more research about heart health. Now, while I'm tiptoeing into things that can get controversial on the internet, but not so much in clinical medicine, let's talk about statins. You may not like them because of side effects, misinformation, or both. If you take a statin, there's up to a 10 to 20% chance you will have side effects, which are usually mild and most commonly muscle aches. Now, when statins were first introduced, some people were like, hey, statins are associated with dementia. Well, guess what else is associated with dementia? Vascular disease, which increases with elevated blood cholesterol levels. And you may hear people say, but your brain needs cholesterol. Yes, it does. But remember, it makes what it needs, and it isn't affected by blood levels. How about this one? Doctors make money by prescribing statins. No, they don't. That's actually illegal, and it has been for a long time. But there was a study that showed that doctors who get a free lunch, which is legal, tend to prescribe the brand name more if they got a sandwich and a bag of chips. I'm not sure it matters much, because by the time you get to the pharmacy to pick up your prescription, your insurance company probably said, we don't cover that. So you get the cheap generic anyway. Like I said before, no doctor has ever told me I should take a statin. But if they did, here's what I would do. I would double down on lifestyle modification. I mean strict. All plants, no cheating, consistently all day, every day, vigorous exercise. And then I'd have my cholesterol checked again in 3 to 6 months. And if the doctor still recommended a statin, I'd take it. Because even though some people do report side effects, I've heard that having a stroke or a heart attack is worse. And if you haven't been to the doctor in a while, call and get an appointment and get your cholesterol checked. Eat lots of fiber, exercise, and don't ignore the other pillars of lifestyle medicine like social connectedness, avoiding alcohol and tobacco, managing stress, and restorative sleep. If you're ready for a deeper dive into heart health, check out the April edition of the Healthy Looks Great on You Lab. Take what you know and put it into practice. Bonus, you'll get a little social connection too. I want you to keep your heart happy and healthy because healthy looks great on you.
The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.